Hello, friends. People who develop Bell's palsy and synkinesis often experience strain, spasm, and pain on the neck region, back of the ear region. This is despite any stage of Bell's palsy. This particularly happens because of the inflammation that's present on the ear. Now, do you know that this particular zone is the zone where your facial nerve is the most superficial? And that's where, if the nerve is inflamed, this area can be painful. So, the practices that I am going to show you today is going to relax not only the muscles around it, it will help you to feel better with that pain and ache that you face and feel around the ear region. So, let's get started with the video. Place your finger on back of the ear and with the help of two fingers rotate in clockwise and anti-clockwise direction. In a similar way, take two fingers, press it deeply, hold for some time and then release. Repeat this process for 5 to 10 counts. With each compression or else pressure of the finger, you're moving your neck in the opposite direction to the affected side, and as you release your finger, you move back the neck. Next, you have to work on an auricularis muscle, which is a muscle behind your ear, which usually gets stiff. So, with the help of your finger, you're going to stroke your fingers in upward direction where you feel pain. Do this process for 5 to 10 counts. Next, you're going to place your fingers above the ear, and from there you're going to stroke your fingers in upward direction. Do this process for 5 to 10 counts. Here, use the pulp of your fingers to do this pressure based massage rather than using your hand. And same way, you're going to repeat the process in front of the ear, where you're going to use the pad of your fingers and you're going to do the circular massage in clockwise and anti-clockwise direction. So basically, you're covering the entire aspect of muscles which is surrounding your ear: front, back, top and bottom. This will release the pressure and the tightness that usually develops around the ear region due to synkinesis and Bell's palsy. This also reduces the pain, at the same time improves the mobility and flexibility of the muscles. Next, place your fingers at base of the ear and then tilt your neck side to side, as you can see in this video. This way you are further stretching the muscle and enabling better mobility. Same way, you are going to place a thumb on the back side of the ear and then stroke that thumb forward as you bend down. This way you are working on a muscle called as digastric, which usually gets ignored in Bell's palsy, but it's a very important muscle which helps and plays a very critical role in mouth opening. When this muscle is tight and painful, you will observe that the mouth opening gets limited and there is an unnecessary tension and spasm that is felt around the ear and neck region. Same way, you're going to use two fingers and you're going to apply deep pressure over this digastric muscle to release this muscle. If this muscle is tense, tight and weak, it's going to pull your face in the downward direction and will give a lot of stiffness in the face. This particular practice helps in reducing that stiffness. So make sure to do this for 5 to 10 counts. Slowly move this finger from backwards to front by applying gentle pressure. This pressure should not be painful, it should be calming and relaxing. Then once that is done, find the spot which is the most stiff spot in the neck region. This is particularly at the junction of the neck where your jaw angle forms. This is where you will find that there is a very stiff and tight muscle, which is your sternocleidomastoid muscle. So you're going to hold that muscle, grab that muscle, and then you're going to do neck upward and downward movement. This also you're going to perform for 5 to 10 repetitions, or else based on your ability to tolerate. You can do this multiple times in a day at short bout as well. After this, the next practice is jaw opening exercise. For this, you're going to tuck your chin down and then you're going to open your jaw in a way where you don't feel any kind of synkinesis. If you are in early phase of Bell's palsy, still you can do this exercise, but make sure don't do forceful movements. Make sure only move your mouth or else only open your mouth to the extent where it doesn't strain your muscles. Same way, look up and then repeat the process of mouth opening and closing. This way, you are going to activate your digastric muscle, which usually is paralyzed but less worked on. At the same time, it will improve the mobility of your mouth and the jaw muscles. Make sure when you're doing these practices, your eyes are relaxed, calm, and not tensed at all. If you feel that your eyes are getting tensed, you can take some pause, calm down the muscle, and then redo it. Next, you're going to move your jaw side to side while looking up. This way, you're going to prevent the unnecessary jaw deviation that develops during Bell's palsy. And that forms your practices for your face. These were some simple practices that you can do. But again, remember, every individual is different and a personalized care is the must. And the personalized care is must when it comes to Bell's palsy and synkinesis. So if you want a personalized care for your Bell's palsy and synkinesis, then feel free to reach out to us so that we can help you better. On that note, I'll end this video here and I'll see you in another video. Thank you.